If you're over 60 and your feet feel numb, weak, or unsteady, this message is for you. A quiet problem may be getting worse every day, and most people don't realize it until balance is gone. After 60, many adults notice small changes in their feet. A little tingling, a cold or burning feeling, toes that don't respond as quickly as they used to. At first, it seems harmless. You shrug it off. You blame age. You slow down just a little. But here's what surgeons and foot specialists quietly warn about. When nerve signals in the feet weaken, the brain loses clear feedback. Balance suffers. Reaction time slows. The risk of falls rises, often suddenly. This isn't about fear. It's about awareness. Because nerve decline in the feet rarely starts with pain. It starts with silence. Signals that don't arrive as clearly as before. Your feet are not just for walking. They are your body's foundation. They constantly send information upward about pressure, position, and movement. When that communication fades, the body compensates. Hips tighten. Knees stiffen. Steps become shorter and cautious. Many adults think the problem is weakness. Others think it's circulation. Some believe nothing can be done. That belief is the real danger. Here's the encouraging truth. In many cases, the nervous system responds to the right kind of gentle input. Not medication, not intense workouts, but simple, purposeful movement. One overlooked daily habit, or lack of it, plays a major role. And one safe exercise, when done correctly, can help reawaken awareness in the feet. This is not about curing anything. It's about supporting what your body still knows how to do. Surgeons see this pattern again and again. Patients come in after a fall. They say, "I just didn't feel the floor." Or, "My foot didn't respond in time." The warning signs were there months earlier, but no one explained what they meant. If you're over 60, this matters. Especially if you've noticed unsteadiness on stairs, or if you feel less confident walking on uneven ground, or if you avoid barefoot walking without knowing why. You are not broken. You are not helpless. And this is not just normal aging. Your nervous system thrives on use, on gentle challenge, on clear signals sent every day. In the next part, you'll learn why foot nerve function often declines after 60, and the common daily habits that quietly make it worse without anyone realizing it. Because once you understand the real reason this happens, the solution becomes surprisingly clear. To understand what's happening in your feet after 60, we need to simplify how nerves really work. Nerves are messengers. They carry information from your feet to your brain and back again. Every step you take sends thousands of tiny signals upward. Pressure, temperature, position, balance. When those messages are clear, walking feels automatic. You don't think about every step. Your body adjusts without effort. But nerves depend on one key thing to stay sharp: regular, gentle stimulation. Here's what often changes after 60. Movement becomes more predictable. You walk the same paths, wear the same shoes, avoid uneven surfaces, sit longer than before. None of this feels dangerous. In fact, it feels safe. But nerves don't thrive on sameness. They weaken when stimulation drops. Think of nerves like hearing. If sound slowly fades over years, you don't notice the exact moment it happened. One day, conversations just feel harder to follow. The same thing happens in the feet. Another factor is reduced foot motion. Many older adults stop using the full range of their feet and toes. Shoes become stiffer. Soles become thicker. Feet stay locked instead of active. This limits the sensory input going to the brain. Then there's posture and walking style. As balance confidence drops, people subconsciously shorten their stride. They place their feet down carefully instead of naturally. The foot lands flatter and heavier. That reduces nerve feedback even more. There's also the issue of circulation changes with age. Blood flow can become less efficient, especially when we sit for long periods. Nerves don't love stagnation. But here's an important correction. This is not about blaming age, and it's not about diagnosing disease. Many healthy adults experience nerve dulling simply because modern life removes the signals nerves depend on. Now let's talk about the most common mistakes that quietly make this worse. Mistake number 1. Avoiding foot use to be careful. Many seniors stop walking barefoot altogether. They rely on thick, cushioned shoes at all times. While shoes protect, constant cushioning also blocks sensation. The foot stops feeling the ground clearly. Mistake number 2. Doing only straight-line walking. Walking is excellent, but flat, predictable walking doesn't challenge nerve awareness. The nervous system improves when it must adapt, gently and safely. Mistake number 3. Ignoring toe movement. Most people rarely move their toes on purpose, yet toes are packed with nerve endings. When they go unused, feedback fades. Mistake number 4. Sitting too long without foot activation. Even active adults may sit for hours at a time. During sitting, feet are still. Nerve signaling drops sharply. Mistake number 5. Assuming numbness means nothing can be done. This belief stops action early, and inactivity accelerates decline. Here's the hopeful part. Nerves respond best to slow, intentional input. They don't require intensity. They require attention. Studies on aging consistently show that sensory awareness can improve when the nervous system is gently re-engaged, especially when movement is controlled and repeated daily. That's why the right exercise is not about strength or speed. It's about communication. The brain must be reminded where the feet are, what the ground feels like, how weight shifts. When this happens, balance often improves. Confidence often returns. Walking feels more natural again. In the next part, you'll learn 3 to 5 simple, medically safe daily habits, including one powerful foot exercise that many seniors can do at home. No equipment, no strain, just clear, step-by-step guidance designed for bodies over 60. And most importantly, habits that respect where you are today, not where you were decades ago. These habits are not treatments. They are gentle ways to support how your nervous system naturally works. Go slowly. Stay within comfort. If anything feels painful, stop. Consistency matters more than effort. Habit 1. The one exercise. Surgeons often recommend first. Seated foot awareness press. This is the exercise many specialists start with because it is safe, controlled, and highly effective at reintroducing nerve signals. Sit in a sturdy chair. Place both feet flat on the floor. Shoes off, if possible. Now focus on just one foot. Slowly press the front of your foot, the ball under your toes, into the floor. Not hard, just enough to feel contact. Hold for 3 seconds. Release. Next, press the heel into the floor. Hold for 3 seconds. Release. Now press the inside edge of your foot, then the outside edge. You are not strengthening. You are teaching awareness. Repeat this pattern 5 times per foot. Breathe calmly. What matters is attention. Feel where pressure shows up. Notice differences between left and right. This gentle pressure sends clear messages to the brain. Over time, those messages sharpen. Habit 2. Daily toe activation. Small movements, big impact toes, contain a dense network of nerves. Most adults rarely use them intentionally. Once a day, sit or stand safely near support. Lift your toes slowly. Lower them. Now try spreading them apart slightly. Even if they barely move, the effort matters. Next, gently curl your toes downward. Release. Do this for 1 minute. If cramping occurs, stop and relax. This practice wakes up dormant sensory pathways. It reminds the brain that the toes still matter. Habit 3. Controlled weight shifts, training balance without risk. This habit improves communication between feet and brain. Stand near a counter or sturdy chair. Feet hip-width apart. Slowly shift your weight slightly forward. Feel the balls of your feet engage. Shift back toward the heels, then left, then right. Each shift is small and controlled. Pause for a second at each position. This teaches the nervous system how weight moves across the feet, something that often fades with age. Do this for 1 to 2 minutes. Habit 4. The 60-second sensory reset, perfect for sitting time. Anytime you've been sitting longer than 30 minutes, do this. Place both feet flat on the floor. Without looking, try to notice 5 sensations. Pressure under the heel, the floor temperature, the arch contact, toe position, weight balance. You're not judging, just noticing. This simple awareness exercise keeps nerve signaling active throughout the day. Why these habits work together? None of these habits overload the body. They invite participation. They give the nervous system a reason to stay engaged. Over days and weeks, many adults notice improved confidence, more stability, a clearer sense of where their feet are during walking. These habits don't replace medical care. They support daily function. In the final part, we'll talk about something just as important as exercises: mindset. Because improvement after 60 is not about pushing harder. It's about trusting that your body can still respond. If you're over 60 and you've worried that your body is slowly slipping out of your control, hear this clearly. You are not too late, and you are not fragile beyond repair. The nervous system is not like a light switch that turns off forever. It's more like a dimmer, and gentle use can slowly turn the light back up. Many adults believe decline is inevitable, that once balance feels uncertain, it only goes one direction. That numbness means damage is done. That belief steals more stability than aging ever could. What truly matters is not how old you are. It's whether your nervous system is still being invited to participate. Every time you press your foot into the floor with awareness, you send a message upward. Every time you shift weight slowly and safely, your brain relearns trust. Every time you notice sensation instead of avoiding it, you reinforce connection. Progress after 60 rarely feels dramatic. It feels quiet. You may notice you're standing a little taller, turning with more ease, walking without watching every step. Confidence often returns before sensation fully does. And confidence changes everything. Falls are not just physical events. They are moments when the brain hesitates, when feedback arrives too late. By keeping foot awareness alive, you shorten that delay. This is why small daily habits matter more than intensity. Why 1 minute done consistently beats 30 minutes done once. Your body doesn't need punishment. It needs communication. Some days will feel better than others. That's normal. Improvement is not a straight line. It's a gradual trend. Be patient with yourself. Respect your limits. Celebrate subtle wins. And remember this: your feet have carried you for decades. They are not failing you. They are asking to be heard again. If you found this guidance helpful, keep these habits part of your daily routine. Return to them gently. Let them become familiar. And if you want more senior-safe guidance like this, focused on confidence, balance, and living well after 60, stay connected to trusted, calm information that respects your body's wisdom. Because aging is not about losing control. It's about learning a new way to care for what still works. And there is far more working within you than you've been led to believe.